Good morning, how are you? Good. I'm just following up about the hospital visits. I get emails on a daily basis about people who have loved ones in the hospital, people who have parents in the hospital that they can't go visit, siblings in the hospital they can't go visit, people with Alzheimer's that are there alone that they don't have anybody with. And that's, for the last few weeks, has been my biggest issue and my biggest concern. It's wrong on so many levels. There's nothing more valuable to someone's health than a family member being able to be there with them. It helps with the recovery. It helps with their mental status. It's just, to think that people are there by themselves during, the scariest times of their lives and they're completely alone is heartbreaking. There has to be a better way to do it. Everybody understands that they don't want COVID to get in the hospital and everybody's trying to keep them safe. But especially where our numbers are so low, if we have an outbreak somewhere, then, shut it down. There's got to be a happy medium. We pack the malls. We pack, 100 people into a store, but you can't have one person going into a hospital that's masked and clothed and with their proper PPE to be able to go in and see somebody. So there has to be a better way. I was really happy to see that they changed the rules for palliative. I'd sent a lot of emails. I talked to a lot of people at the minister's office about it. To have somebody dying alone is horrific. You get message after message of
It really weighs on you.
It does. This stays with families for the rest of their lives. Well, they do rapid testing at the hospitals. Like, why not? You're screened when you go in. Having one person, and who's there for the contact tracing. You're able to, you'd be very quickly able to find out or to have to trace back. If you're screened when you go in and you're tested and your temperature checked, that they do at the door of every hospital, I don't see where there be any more of a risk than staff going in all the time. And there's no relief in sight. And especially people with Alzheimer's, not sure, where they are. They're not sure why they're there, and they have nobody to explain it to them. There's so many scenarios of why it's important, not only for the patient, but for the family to be in there as well.
So bottom line, something has to be done to improve the situation that's not working for a lot of New Brunswickers.
For a lot of New Brunswickers. There's nobody that should be in the hospital that it's okay to be alone. And we've been told by public health and the government officials that this is going to be around for a long time. So, and we've been told that we have to learn to live with it. There's going to be cases coming up, and they've done an amazing job, to flatten the curve and to keep our numbers down. But we do have to live with this, and we can't lock people out of those hospitals and with their loved ones for weeks and months at a time. There's people that are palliative patients, but not in the palliative unit. So they only have days or weeks left, but they're not allowed to have any patients with them or any family members with them. So it takes its toll, and a lot of people, their health declines just because that they're in there all by themselves.